a patient with head and neck cancer that's getting radiation and chemotherapy is definitely going to have some mucositis. And the degree varies depending on what chemotherapy they're getting, as well as where exactly the radiation is and that kind of those kinds of indices. But it's really important for patients to keep your mouth clean. After every meal, rinse with salt and soda mouthwash or some kind of bland rinse, as long as it doesn't have alcohol in it. And there's lots of mouth rinses out on the market now that don't have alcohol in them. But even if it's just water with a little baking soda in it, that's really good. Rinse your mouth out at least 3 times a day, every time you eat, before you go to bed. Brush your teeth, and the recommendation is 90 seconds per tooth throughout the, every time you brush your teeth. Just keeping your mouth really clean. And then letting your provider know when you have any changes. So if you just feel some tingling, sometimes that's a first kind of sign. And so they can maybe provide some more pain medication for that. There's not a lot of things out there right now to treat oral mucositis, so it's getting you through it. That is the big thing. And so, but there are pain medications and mouth rinses and things that we can do to help you get through it. As far as eating, you should avoid things that are spicy, that are really hot, because those can damage the oral mucosa also. Avoid things like alcohol and avoid smoking, because those again can irritate that oral mucosa more and make that even more painful. So keeping it clean, avoiding those kinds of foods. You don't want to eat anything with like potato chips or things like that that could cause irritation anyway. And then sometimes because of the dryness that you get with the radiation, eating foods that are softer, that have gravies on them, and those kinds of things are really helpful. Good nutrition is very important during your chemotherapy and radiation because it will help you to heal quicker.